Hi, I'm Lisa Making. I'm 53 years old and live in Drumheller, Alberta, Canada. In 2020, at the beginning of the pandemic, I began my dream job as the executive director of one of Canada's most visited museums, the Royal Tyrrell Museum of Paleontology. It was a tough time to take on a leadership role, but I slogged my way through. About 2 years later, just as things were easing at work, I was hit with another bombshell, ovarian cancer. In April 2022, I was diagnosed with stage 1C3 mucinous carcinoma. As you all know, being in an early stage means my prognosis is good. I was lucky. My primary care physician acted quickly. Within 8 months of seeing him, I'd had my surgery, followed by 6 rounds of the standard chemotherapy for ovarian cancer, and was declared an ED. However, what I learned about my subtype since then is that the standard of care isn't always successful for MOC. I have no family history of ovarian, stomach, or colon cancer. My genetic testing was negative for BRCA and Lynch syndrome. If there's a relapse, my treatment options become a guessing game. I recently had my checkup with my oncologist. CT scan was clear, but I'm experiencing some significant stomach and bowel issues. Going into that appointment, I figured I'd get a referral to a dietitian, thinking it was just scarring. Instead, my doctor looked at me gently and firmly said, "You have mucinous, Lisa. We have to rule everything out." Now I go for more tests. I try to remain optimistic and look to the statistics, but when I do, I can't help but think of how rare it was for me to even get MOC in the first place, and that the odds weren't in my favor back then, so what's changed now? I understand that the rarity of MOC poses a significant obstacle towards developing disease-specific trials for new treatments, especially when you compare it to the impact of other, more common ovarian cancers that are BRCA positive on our population. But for those of us with rare subtypes and no genetic connections, we just don't fit these categories. Our options are not just heartbreakingly limited, but often non-existent. I know research on rare subtypes is happening around the world, but it all seems to be in isolated pockets with little progress. So my message today is that I invite each of you to consider the impact you can have as a whole. Collaboration in scientific research can give patients like me not only hope, but also let us know that somebody out there is looking out for us. Thank you.